We'll just let people join, just a few seconds to let people join. Welcome, everyone. Good morning, good evening, good afternoon. Welcome to today's EPI-WIN webinar on seasonal influenza vaccination, protecting the vulnerable. A very relevant topic. I'm Supriya Besbara. I'm the lead for EPI-WIN. Those of you who follow EPI-WIN regularly know me already. For those of you who are new, let me tell you a little bit about EPI-WIN. It starts for the WHO Information Network for Epidemics. Our goal is to make credible knowledge and science accessible, understandable, relatable, and actionable for evidence-informed actions and decisions, both by communities, the public, and decision makers. So today we have an exciting set of speakers. It follows a recent SAGE meeting on influenza vaccines. So we will have Dr. Iona Giga, who's the lead for medical countermeasures, planning for access, allocation, and deployment of pandemic influenza medical countermeasures and the WHO BioHub system to set the scene. Then we have Shoshana Golden, who's the technical officer in medical countermeasures and leading on seasonal influenza vaccination, telling you about who should be vaccinated and why. Then, of course, we have Wenqing Zhang, who needs no introduction in the influenza world. She will talk about how the global seasonal influenza data is used to provide recommendations on vaccine composition. Then we have a panel of experts. We have Chesko Nogadera from from PAHO WHO. We have Yasmin Vargas from UNICEF, and we have two Ministry of Health representatives from countries, Nizar Masweda from the Jordan Ministry of Health, and we will also have Svitlana Alexenko from the Ukraine Ministry of Health. You all know what to do by now, I think. We'd love to hear from you, so please introduce yourself in the chat. But if you have questions, and I hope you will have lots of questions because we love your questions, that's what makes EPI-WIN rich and interesting. We would like you to put it in the Q&A box. You already know that, most of you. Questions in the Q&A box, but your introduction, your insights, anything you'd like to share with others, please put in the chat. Then the housekeeping. This webinar is being recorded and the recording will be posted on our EPI-WIN website, which will be in the chat. The link to that will be in the chat. So if anyone you know has missed it, please do share it with them. EPI-WIN is for sharing knowledge, as I said. It's for exchanging what we know with each other as a global community. So please keep everything respectful. Keep your comments respectful, constructive, positive. We'd love to hear from you, but please constructively, positively. And please keep it to the topic as well. Anyone who does not follow these rules will be removed from this list. But fortunately, we have not had to do that very often. But we hope you will enjoy this webinar. We hope you will find it useful. And with that, I request Iona to set the scene. Over to you, Iona.
Thank you so much, Supriya, and thank you for creating the space to allow us to have this discussion. So today's webinar is on influenza. And influenza may feel familiar to many, something that comes around every season, but really it's quite extraordinary. It is one of the few viruses that demands our constant attention. It's not only because of the toll it takes each year, but because of the threat it carries for the future. And with this in mind, that's why the global community came together under the global influenza strategy. And you have the slide here, and set a vision, which is quite ambitious, but it is essential. And this is really to make sure that we achieve the highest possible level of influenza prevention, control, and preparedness to safeguard the health for all people everywhere. So what's powerful really about the strategy is that it's not just about one intervention here and there, it's about looking at the whole system. How do we rapidly understand the virus as it changes? How do we translate the knowledge into research and development? How do we strengthen the seasonal prevention and control measures that protect us every year? And really, how do we make sure that all this prepares us for something even bigger, which is the next pandemic that is going to come at one point? So on the one hand, it gives us clear goals and outcomes so that we can track progress, we can course correct, adapt where needed, but most importantly, it makes sure that the work we do has real impact, both now on the seasonal front and also in the years to come and the challenges that we may face. Next slide, please. So what makes influenza different from other diseases? And I think it's really fundamentally two things. One, it's danger, and the other one, it's unpredictability. Every year, influenza kills people, around 290,000 to 650,000 people worldwide. And if we just think about this for a moment, it's really hundreds and thousands of people that lose their jobs, families that lose their life, families that lose their loved ones to a disease that we can't prevent. So really, this is something we need to change. And on the other hand, as I mentioned, influenza is also a master of change. It mutates constantly, and that means that the virus that causes seasonal illness can change very rapidly and spark a disastrous pandemic. So that's why what we do right now on the seasonal prevention and control matters so much also on the pandemic front. And we do have tools to fight back. And we really need to use all of them. So therapeutics and antivirals are one of the most representative ones in that space. Diagnostics, public health and social measures. But among these tools, vaccination really stands out as one of the most powerful ones. So with this, I'm very pleased to give the floor to Shoshana, who is the lead for vaccination, and will walk us through the next slides. Shosh, over to you.
Thank you so much, Ioana. And to start us off, we'll have a brief interactive exercise. I welcome colleagues in this webinar to scan the QR code at the top left side of your screen, or in your web browser to go to slido.com. Our poll number is 3126421. Over the course of the next several minutes, we'll have a series of questions for you to respond to. And these will be focused on how we can best protect ourselves and others from seasonal influenza. I can see that colleagues are already able to join the poll. We will give you just a minute to be able to read through the questions, potential response options, and then we'll take you over to see the results. As you're completing the poll, I will go ahead and read out that question and the response choices for you, noting that this question really aims to address some of the mis- and disinformation circulating about seasonal influenza prevention and control. We're asking, what actions can you take to protect yourself and others from seasonal influenza each year? The potential response options are washing your hands, avoiding going outside with wet hair or without a coat, getting vaccinated if recommended and where vaccines are available, drinking chicken soup and orange juice, and using respiratory etiquette, which of course means sneezing or coughing into an arm or elbow, not into your hand. And I can see that we've got more than 130 respondents already working on this poll. So I will go ahead so that you can start to see the response options. I think not surprisingly, given the focus of this webinar and the great introduction provided by Ioana, our grand majority of participants are focused on getting vaccinated to protect themselves and others. We recognize that influenza vaccines are available in about 75% of WHO member states, so it's not always accessible to people. If vaccines are not recommended for you or are not available for you, other options to start to protect yourself from seasonal influenza, including washing your hands, using respiratory etiquette, and it's lovely to make sure that you are drinking chicken soup and orange juice, but that is not going to be sufficient to protect you from the influenza virus. Will take us over to the next slide, where I'm going to now ask you to comment on who WHO recommends get vaccinated against seasonal influenza each year. So on your app or on the slido.com poll, please feel free to respond. And I see the numbers are rapidly rising. We'll give just a minute for participants to respond to the question. The response options are all of the above: health workers, people with chronic conditions, older adults, and pregnant women. And we can see already that we've got more than 130 responses, and we have the grand majority of people saying all of the above, which is in fact the correct response. WHO recommends that all countries consider introducing or expanding their seasonal influenza vaccination programs, and WHO specifically encourages countries to focus on 4 priority target groups, the ones that you just mentioned on the screen before: health workers, people with chronic conditions, older adults, and pregnant women. With that being said, it is important to recognize that WHO also encourages countries to consider additional target groups based on the national disease burdens, priority, resources, and of course, the programmatic feasibility components. And in particular, what we see is that more than 80 countries in the world also recommend seasonal influenza vaccination for children, for example. Other groups include people living in dense settings, or Hajj travelers, people traveling to mass gathering events, and people who might be at risk for severe influenza, such as disadvantaged populations or indigenous communities. If you'd like to learn more about WHO's recommendations for seasonal influenza vaccination, please do look at the link available on the slide. We will also put this in the chat so you have this information accessible. With that, I'll take us to our final question for you. The question is, why do people need to be vaccinated against seasonal influenza annually? And this is slightly different. You'll have to actually type in a response. So if you can type in just a couple of words to indicate why this vaccination needs to occur annually. Fantastic. We have phenomenal responses coming in, and I see them congregating into a couple of key themes. The first is around the mutation of the influenza virus. And we recognize, we'll hear from our colleague, Dr. Wenjing Zhang, in just a minute, how the influenza virus mutates. And we need to ensure that people are being vaccinated against the virus strains that are most likely to be circulating in their communities. We also know that there are waning antibodies. So really glad to see the responses on boosting the immune system to make sure that people are protected against influenza as the new season is approaching. A quick summary of why seasonal influenza vaccination is important. As Ioana said, it saves lives. So it has an individual benefit, but it also helps to support the community by protecting others. And of course, it has this pandemic preparedness component that helps to protect the world against a future event. Because of seasonal influenza vaccination each year, we see a reduction in deaths, hospitalization, cases, but also absenteeism. People who aren't getting sick are able to go to work, and whether that's a health worker going to work in a hospital or a teacher who's going to work in the school, those functions are so important for our communities and our societies. We also see this annual vaccination supporting countries in building their national capacities, whether it's having sufficient cold chain facilities or trained human resources. and this translates to real benefits in a pandemic context. During both the 2009 and COVID-19 pandemics, countries with an existing seasonal influenza vaccination program in place were able to deliver the pandemic vaccines faster, reach higher coverage, and have fewer regulatory barriers than countries without that pre-existing seasonal influenza vaccination program. With that, I would like to turn the floor over to my colleague, Dr. Wenjing Zhang, who'll be talking with us about the influenza vaccine compositions and how they're updated each year.
Excellent. I hope you can hear me well. And let me also set the timer on 5 minutes. So as you all know from the response that a notorious feature of influenza virus is a constant evolution. And here there's a tree and a lot of color bars attached to the branch. This is the evolution, genetic evolution of influenza virus. And actually it is only from March this year to September this year. I also amplified the columns here. So these are set of the data either collected from countries, from the surveillance, or generated from the gizzard itself. So when we talk about evolution, we should bear into mind it's not only genetic evolution, but also antigenic evolution. And this antigenic evolution is super important for the update of vaccine composition. Next. So the base of WHO's update of what viruses should go to the vaccines for the upcoming season is the global surveillance. It is conducted by GISRIS, GISIS, the Global Influenza Surveillance and Response System. And so far, as you see, that it covers more than 160 institutions in more than 130 countries. I would like to give a big thank you to all our members in the system, but also the hosting countries, public and private partners, like from both the veterinary sector, research academia, and many others, collaborators. Next. So if we zoom in to what exactly are data being used for us to decide whether to update to remain the same or update the composition, this is a list. One is the surveillance data. This is from countries. And the other is the antigenic characterization data of the viruses to see how far the evolution of the antigenic features of those viruses. And again, the next one is human serology studies with influenza vaccines. This data is very important to measure how far the viruses is moved ahead from the current vaccine composition. So this would help us to decide whether there's a need to update or not. Genetic characterization of viruses, I think this is, most people know that, this is the genetic evolution of the viruses. Virus fitness forecasting, this was introduced in the recent years because there's a huge amount of the data. So we can use the data to do the forecasting to see what type of clades of the viruses most likely will be emerge, increasing, and probably predominate in the upcoming season. Antiviral resistance data is, of course, is very important and are also taken into consideration when we make the decision. Vaccine effectiveness data is supplemental and also assisting the deliberation of the change of the composition or not. Another very important piece of the information is the status of the development of the candidate vaccine viruses, CVVs. This is important in a way so that the WHO's recommendation can be implemented after it is issued. The final decision will be made by the WHO's advisory committee in the WHO's consultation. So on the right side, last week, WHO convened a consultation and recommend the composition for the Southern Hemisphere 2026, and the link I included here. I would like to end by saying is that WHO not only recommend the updated vaccine composition, but also coordinate the development of the candidate vaccine viruses and also the potency reagents for the release of the vaccines. And all this is to make sure that the vaccines are going to be used in the season is updated, standardized. And this is a link I included here just in case people is interested in looking to this. That's all from my side. Back to you, Shush.
Thank you so much, Wenjing. We'll now turn over to our panel of speakers to hear about a number of different topics that might be relevant to you and the work that you're doing. We'll hear first from Dr. Chesco Nogueira about the impact of influenza vaccination. We'll then hear from our colleague, Dr. Yasmin Vargas from the UNICEF Supply Division about how countries can access influenza vaccines, to be followed by our two Ministry of Health speakers, Dr. Nizar Maswade about the behavioral and social drivers of influenza vaccination, and then from Dr. Svetlana Aleksenko about how Ukraine has increased access to seasonal influenza vaccines through introduction of pharmacy-based vaccination. With that, I'll turn to our first panelist, Chesco, to talk with us about how PAHO has done work with WHO and countries to identify the impact of influenza vaccination.
Thank you, Shoshana, and good morning, everyone. It's been largely demonstrated that influenza vaccines reduce the burden-associated disease. And at PAHO, in collaboration with WHO and CDC, we developed a methodology to actually quantify the influenza burden averted by vaccination in terms of deaths, hospitalization, and medical visits. So for those countries, they are using the influenza vaccine. With this methodology, we estimate the averted burden in the existing influenza vaccine campaign for a given vaccination coverage, for specific target groups, for a specific vaccine effectiveness, and for a specific duration of the campaign. So countries with the influenza vaccine in place, they can estimate the number of hospitalization, deaths, and medical visits that have been prevented by the vaccination. Also, for those countries that are not introduced yet the influenza vaccine, this methodology can also allow to determine the potential impact of introducing the influenza vaccine. So it estimates the hypothetical number of hospitalizations, deaths, and cases that would be averted if the influenza vaccine is introduced in that specific country. This approach allows us as well to optimize and improve the timing of vaccination. So modeling different scenarios of starting the vaccination campaign and also the duration of the vaccination campaign allow us to really determine the optimal strategy for influenza vaccination. It also compares the impact that we will have for different types of vaccines. For instance, country is using a standard dose vaccine and is considering to introduce the high dose vaccine. So with this tool, this approach, we can also estimate the impact that we will have for these two types of vaccines. But also for countries they are considering or they are assessing the type of formulation, northern hemisphere or southern hemisphere, we can also estimate the number of hospitalizations and deaths that would be averted using one formulation or another. This is particularly important for countries in the tropical and subtropical areas with no clear seasonality. So what we do with this information? This information is really crucial and important because it gives us a strategic information about the benefits of vaccination. And this is very useful for stakeholders and decision-making, for advocacy and for justified investment in vaccines. but also to the public, to the population in terms of risk communication. And finally, the impacts of influenza vaccination evaluations contribute to economic evaluation. So if we know the number of hospitalizations and deaths in case that have been averted or prevented, we can also estimate the cost associated that have been prevented. So we, as I mentioned, PAHO with WHO and CDC developed this methodology. We just published guidance and a tool. These are available in the link at the bottom. And I would like to finish with showing that in the graph, the type of results we have with this analysis. You can see in the graph the number of hospitalizations for a specific target group. And as you can see in the dark gray represents the number of hospitalizations that have been averted for a given coverage and a given duration of the campaign. So that's exactly what we would do. We've been doing this in different countries, in several countries in the region, in the Americas. So thank you, and over to you. Thank you, over.
Thank you so much, Cesco. We'll now turn to Yasmin to hear about countries accessing influenza vaccines through UNICEF Supply Division.
Thank you. Good afternoon to everyone. I hope you can hear me correctly. So in addition to supply regular UNICEF programs, we undertake procurement on behalf of governments, other UN agencies, NGOs, philanthropic organizations, and universities. Individuals and profit-making entities are not eligible for accessing these services. Especially for in-seasonal influenza, demand through UNICEF is relatively low, as most countries procuring other vaccines through UNICEF do not implement seasonal influenza immunization programs. But in the last 4 years, the demand has increased to an average of 1.4 million doses for 14 of 17 countries, and primarily for the Northern Hemisphere formulation. A subset of countries that procure seasonal influenza through UNICEF receives funding support from the Partnership of Influenza Vaccine Introduction, PIVI, under the Task Force of Global Health. So how to use UNICEF procurement services? To start the process, the partner or the government must submit the procurement services request that you can find it in the link with all the information required. If it is complete, a draft cost estimation is prepared by Supply Division. Information about the cost of the good, the handle fee, freight, insurance, the contingency buffer, usually 6%, and Incoterms are all included in the cost estimation. In parallel, or upon acceptance of the cost estimation, a memorandum of understanding is signed. We only initiate the procurement activities when we receive the funds in Supply Division. We don't have a long-term agreement for this vaccine, so we have a tender process each year. For the Southern Hemisphere, we need to receive the cost estimation on October, and funds must be reached by the end of November. If we don't receive the funds in those dates, it will be difficult to access the vaccine. And of course, the delivery during April and June before the season. And for the Northern Hemisphere, countries should be requested by mid-October, and funds reach to Supply Division in December. The delivery during September, November, of course, before the season begins. Thank you. Over to you, Shoshana.
Wonderful. Thank you so much. When we talk about seasonal influenza vaccination, we often hear that there is a misperception about the severity of influenza. And so we really appreciate the work of Cesco, Vanessa Kotze, and many other colleagues to really understand how much burden can be averted by vaccination. The other topic we commonly hear is about access and affordability. So a huge thanks to Yasmin for being able to walk us through the process for countries to access seasonal influenza vaccines at quite affordable prices. And I do want to draw your attention to that Northern Hemisphere timeline and that Southern Hemisphere timeline, both being around October. So really now is the time for countries to be thinking about whether or not they would like to procure vaccines through UNICEF Supply Division. We'll now transition over to hearing from our two Ministry of Health speakers. First, turning to Dr. Nizar to talk us through what Jordan learned from their use of the behavioral and social drivers of the influenza vaccination resource.
Thank you, Shoshana. Hello, colleagues from every part of this world. It's a pleasure to join you today. My topic will be a focus about understanding the behavioral and social driver of influenza vaccination in Jordan. Let me first express about my proudness that Jordan is the first Arabic-speaking country to apply this tool to study vaccine acceptance and demand. When we looked firstly at the seasonal influenza vaccination in Jordan, one thing was clear. It was not fully understood, so that's why. By using this BCDS tool, WHO tool, we explored how people think and feel about influenza vaccination, what their motivation, and what the practical barriers they face. So the study helped us to understand not only the barriers, but also to find the solutions. We started with the qualitative BCD research, which gave us opportunity to dig deeper into influenza vaccine barriers. Qualitative phase were in two governorate to express more kind of population. Our targeted group, not only the recipients, we listened carefully to recipients, vaccinators, and influencers. Even me, as the EPI manager, was involved in this study to understanding more about what the barriers and the challenges that we faced in seasonal influenza vaccine. So this helped us to understand. Then we moved to the quantitative, which gave us a measurable. Sorry. Which give us a measurable data, we did a quantitative BCD survey, which gave us, we surveyed 1,500 people, healthcare workers, pregnant women, and elderly. The BCD first looked at practical and informational barrier. What we found? We found the four main issues. Availability, continuous of availability of the vaccines. This is one of the most as challenges that's to increase the trust of the vaccine. Also, the accessibility, distance, and the transport made it difficult for some people to reach vaccination point. Affordability, in some cases, people thought the vaccine was costly or were not sure if it was free. Information gaps, confusion about the eligibility group. And also we highlighted about the behavioral and expectation challenges. People expressed concern about safety and side effects, especially the elderly, because a lot of framers, especially after COVID, so many older adults had a low perception of risk, saying influenza is not as serious, especially that from rural area. And overall, we saw post-COVID vaccine fatigue. So our recommendation focused on increased accessibility of services, building trust by increasing the awareness. Health providers also provide clear communication on free vaccination and standardized eligibility criteria about also improve forecasting and distribution and regular monitoring and evaluation. So the overall conclusion, the study demonstrated the urgent need for a national seasonal influenza vaccination policy in Jordan to institutionalize these recommendations and ensure sustainable evidence-based planning. Thank you. Over to you, Shoshan.
Thank you so much. If colleagues have questions on any of these topics, but certainly focusing on this behavioral and social drivers of influenza vaccination toolkit, which was just published earlier this year, please do put into the Q&A your questions for Nizar and for the WHO focal point for acceptance and demand, Lisa Menning, who's also with us on the webinar today. We'll now go to our final speaker. Building on what Dr. Nizar said about the importance of expanding access to seasonal influenza vaccines, we'll turn over to Dr. Svetlana to hear about Ukraine's work to expand access by introducing pharmacy-based vaccination.
Good afternoon, colleagues. Today, I am pleased to present an initiative of Ministry of Health of Ukraine that will allow citizens to receive influenza vaccination directly in pharmacies. Until now, vaccinations was only available in healthcare facilities. With this reform, people will be able to access vaccines in convenient and familiar location close to their homes. Our objectives were, firstly, increase influenza vaccination accessibility for all citizens in wartime in Ukraine, where hospital become a military target. Second, provide an alternative to hospital-based vaccination sites will ensuring full compliance with Ukrainian law to protect patients and pharmacists in case something goes wrong. Third, reduce the load of healthcare facilities and family doctors. And finally, reach more people through to extensive pharmacy network across the country. The successful implementation of vaccination in pharmacies requires a comprehensive package of national measures. Amendments to Ukrainian health legislations, training pharmacists, coordinating suppliers, and including pharmacy vaccinations model in medical university curricula for future pharmacists. Organizing system of training and quality assurance for pharmacy workforce. Conducting nationwide public awareness campaigns to build understanding and trust among citizens. And ensuring active collaboration with international partners and stakeholders. It is important to mention that financial and technical support for training pharmacists has been provided under the WHO Pandemic Influenza Preparedness Framework, also known as PIP support. Ukraine was identified as one of the 6 PIP priority countries in the European region, which made this support possible. What we expanded as impact of this initiative is significant. Wider access and convenience will especially benefit people in underserved and remote areas. Higher vaccination coverage will strengthen community immunity. By reducing clients and patient flows in hospitals, we will relieve pressure of healthcare professionals and facilities. Trust in prevention service will grow as citizens expensive vaccines in a combination and reliable pharmacy setting. As conclusion, we need to mention that despite the war and the destruction of many healthcare facilities, Ukrainian countries to move forward. By implementing influenza vaccination in pharmacies, we are not only addressing immediate challenges, but also laying the foundation for a stronger, more resilient and European-oriented public health system. Thank you for your attention.
Wonderful. Thank you, Dr. Svetlana. And it's great to hear about this example of how Ukraine has really aimed to increase access to these vaccines by making them accessible in pharmacy settings. With that, we'll transition over to our question and answer period. We welcome all of our webinar participants to ask questions about seasonal influenza vaccines and vaccination. Please feel free to ask questions about any of the topics you've heard today or other things that might be of interest to you. And I'll now hand over to my colleague, Dr. Iwana Giga, who can help us to moderate this Q&A session.
Thank you so much, Shoshana, and thank you to all the panelists and to Wenjing, of course. This has been so rich and a lot of information, and I think as a testament to this is the large number of questions that we have in the Q&A. So I'll try to do them justice and to combine them a little bit so that we can get through all of them. I kind of identified certain themes, so maybe we can start with those around the personal protection or the basics of vaccination and the non-vaccine preventive measures as well. So a set of questions were around, of course, we heard from the presentations who should get vaccinated, but maybe we can delve a bit more into when is the best time to get vaccinated? Do we need to do it every year? Can these vaccines be administered along other vaccines? I think obvious ones are COVID maybe. And also beyond vaccination, what roles do measures like masks, ventilations, other public health tools still play in protecting people from influenza? So maybe we start with these very quickly, and then we transition more on the research side to vaccine effectiveness and innovation and the access elements. So I don't know who wants to start. Shosh, you're the obvious.
Sure, happy to start. And colleagues, please do feel free to add as well. When to get vaccinated, it's important to recognize that the influenza vaccine takes about 2 weeks for the immune response in your body to work. So you want to be vaccinated in the influenza season, preferably towards the beginning of the season, so that your body has sufficient time to develop those antibodies before you're exposed to the circulating virus. We do often see vaccination occurring throughout the October to December period in the Northern Hemisphere, and between April to June or July in the Southern Hemisphere period. It does depend a little bit on when the country might actually receive the influenza vaccines, when the national campaign will start. For the question about why we need to be vaccinated each year and whether we can co-administer with other vaccines, as we mentioned at the beginning of the presentation, there are two components. The first is the evolution, the mutation of the influenza virus. Because of that, we want to make sure that people are being vaccinated with the strains that are most likely to protect them. That composition process that you heard about from Wenjing is essential to making sure that the vaccines that are available for people reflect what is best predicted to be the circulating strains. But also there's an issue with many respiratory vaccines about waning immunity over time. The influenza vaccine provides its best protection within the first 6 months. What that means is that annual vaccination ensures that people are protected for each influenza season that occurs. And the final component on co-administration, influenza vaccines can be co-administered with other vaccines. If you'd like detailed information about which vaccines, this is available inside of the WHO position paper, which we can include in the chat. Would other colleagues like to respond to any of these questions?
Can I?
Yes,
Yes.
please.
Yeah, because Iona, you also mentioned about like the use of masks and other measures together. So it is important also to emphasize that vaccination should not be considered as a replacement of those public health social measures. It's common sense of those like you need to wash hand. Although it may not be like chicken soup, right? At the very beginning, you have a question about chicken soup and orange juice, but like wearing masks, not getting to the very crowded places in the winter, especially when the virus is at the peak of circulation without masks. So I just want to add a point of this. Back to you, Iona.
Thank you so much, Wenjing and Shoshana. I will now move on to the questions that are more around the scientific choices and the effectiveness around vaccines, their formulation and the innovation in this space. I think Wenjing, you are, I will ask you to take first the floor because it's also about the CVV and the choices around that. So some of the participants were wondering, how do vaccine design choices, for example, attenuation methods, these annual updates, maybe deciding the dose in the vaccines, how do these affect the safety, the effectiveness, and the long-term immune responses across different groups? Also, Wenjing, you explained very nicely how the seasonal influenza vaccine formulation is chosen each year. But considering that we might be looking at combination vaccines with the influenza, COVID, or RSV, how will this process transform or look like considering we might have this combo?
I think this is a huge amount of questions, and certainly I will start, and I'll ask other panel members also to complement. Maybe I'll start with the candidate vaccine viruses. Why we need that? So in order to produce a vaccine, they need to have the needed volume of antigens. The wild circulating viruses, it doesn't grow, let's say, efficient enough. So there is a need for a different type of viruses which can grow efficiently to produce the needed antigen. And this actually comes from the candidate vaccine viruses. And these candidate vaccine viruses have been developed under the coordination of the WHO systems, the GIS, which stands for the Global Influenza Surveillance and Response System. I think this is also a question there. So another question is that because WHO gives a recommendation like a month in advance before the season hits, how actually we make such recommendation? So the data I presented on my slides is a huge volume of those. What the advisory group members are looking into the current circulating viruses and into very much details. For example, what are the subclade or subclade is emerging that actually associated with the antigenic change? And what is the projection of this particular clade or subclade is going to fly in the upcoming months? So these are all the information is being taken into consideration and to decide which one is most likely will be predominating in the upcoming season, then this one will be the chosen one. But as you pointed out rightly, that in the past there were seasons that the WHO recommended strain didn't actually antigenically match so close. The circulating viruses occurred eventually during that season. And this again is because of first is that it's always before the season. The second, again, why it need to be given before the season is the limitation of the technology of the vaccine development. Because at the moment, the licensed vaccines would take 4 to 6 months. So that's the reason WHO we need to give recommendation so early. If in the future there are new vaccines, next generation vaccines that would take much shorter time to produce, then we will be able to give the recommendation later and close to the season. Certainly, that would increase the likelihood of the so-called match or mismatch. But I don't like the word match or mismatch because it didn't really explain in full why we need to change or not change itself. Maybe I'll just stop here because you listed a lot of questions, and I hand over to other panelists where to chime in.
Thank you so much, Wenjing.
If I can briefly comment on the combination vaccines as well, to build from Wenjing's response, we do anticipate that these are likely to be available in the near future. It depends a bit on what types of combination vaccines are licensed, what type of programmatic efficiencies or constraints there might be. So for example, influenza and COVID-19, which are recommended annually, this certainly makes a lot of sense. Currently for RSV vaccine, we do not recommend annual vaccination. So having that combined vaccine might actually be useful for 1 year for an individual, but after that, they're going to need just their regular standalone influenza vaccine for future seasons. As these vaccines become licensed and available, I think we're also going to see some significant cost implications because these vaccines are likely to be much more expensive than our traditional products. So I think they certainly offer us great potential, but they will not be a magic solution by any means.
Thanks, Shoshana. I want to make a comment on the effectiveness of the vaccines. We observe different effectiveness over seasons, so we don't have a really fixed number or a fixed effectiveness, protection effectiveness against disease or hospitalizations. And this is mainly because effectiveness is influenced by different factors. First, the age. We know that the age is an important factor. So older adults usually have less effective vaccines, are less effective in this group because of the immunosenescence, right? Which is typical for other vaccines as well. Other factors are the health status, the presence of comorbidities. Also, the time since vaccination also affects the effectiveness. But the most important factor, I think, is what one thing was mentioned is how the vaccine composition and the circulating strains are similar, or how different are. So to protect this so-called matching between the vaccine composition and the circulating strains. That's why we need to really monitor the circulating virus around the globe to inform the committee for vaccine composition to decide what's the optimal vaccine composition for next season. We also observe that vaccine effectiveness depends on the subtyping circulating, the predominant subtyping. We usually see that when we have a season, predominant season H3N2, the vaccine effectiveness is usually lower when we have a H1N1 vaccine campaign, H1N1 predominant season. So there are multiple factors that can affect the effectiveness of the vaccines. I think the key message is the vaccines are effective, protects against severe disease, against death, and I think especially it's critical for priority groups, for high risks groups. Exactly. Thanks.
Thank you very much, Cesco. We don't have much time left, so I want to really capitalize on the fact that we do have colleagues from UNICEF, and also our country, our policymakers are here. So maybe I'll move to the set of questions that have to do more around equity, financing, and national programs. And I would like to get your reflections on what are the biggest system-level challenges countries face in making these influenza vaccines accessible, thinking whether it's the way they are included in the national programs, any insurance aspects, financing, delivery. And also there were a couple of questions around the barriers and the perception of vaccination across different groups, and how this might have been impacted or by the COVID pandemic, if there has been a change following this. So more on the acceptance and demand elements. So would like to hear more from, I guess, our colleagues who work in the country first, and our colleagues from UNICEF, and then we can go back to our WHO colleagues as well. So maybe, Yasmin, can I put you a bit on the spot and ask you to come in first?
Yes, for sure. As I said, for UNICEF, the demand is relatively low because the countries don't implement seasonal influenza immunization programs. And that's the first constraint that we have, right? The funding and the timeline. We need to have funds, as I said, in a very short time frame. And it will all go with the budget of the countries. Although we do have a special price and we can ensure the availability of the vaccine, pre-qualified vaccine, WHO pre-qualified vaccine, I must highlight that. But it is the budget, one of the more constraints about this vaccine, at least from our side.
Mm-hmm. Thank you very much, Yasmin. May I ask our colleagues from Jordan and Ukraine to also offer some reflections around these set of questions? What are some of the challenges to introduce the vaccines around acceptance and demand?
Yes.
Thank you for the question. Ukraine has expanded access to seasonal influenza vaccines by introducing vaccination directly in pharmacies. Citizens can now purchase vaccines at the pharmacy, undergo a medical check, and receive the influenza vaccination on site. Recent amendments to health regulations allow pharmacies to administer vaccinations without the direct involvement of a family doctor while ensuring the safety in the proper registration of immunization in accordance with national legislations. In addition, focusing on priority population groups is helping to increase immunization coverage and strengthen the country's preparedness for influenza threats. These measures also bring Ukrainians' healthcare system close to European standards and global best practice.
Thank you very much. And that's such a great achievement. And I imagine that also the legislation had to go through a review process to enable this change. So really congratulations for this achievement. Dr. Nizar?
Yes. In Jordan, I will just reflect some thoughts that's related to how to enhance the overall investment in the seasonal influenza vaccine. I think it's very important to advocate about the seasonal influenza vaccine. So build advocacy networks with all the stakeholders to increase the surround sound on the seasonal influenza vaccine. Also participate in global and regional to elevate, drive policy agendas and try to maximize all the benefits from that reflect about how to enhance seasonal influenza vaccine by evidence based. So this is very important. Also, trying to work with all the stakeholders, especially the private sector in Jordan, because in Jordan, the private sector that provide more than the public sector. So it's very important to build this, to strengthen our partnership with private sector to identify more solutions for increase the uptake and coverage. Thank you. Over to you.
Thank you so much. And that's such a good example of best practice and how to overcome some of the challenges that appear. Mindful that we have 3 minutes, I'm going to ask on this set of questions, are there any other reactions from colleagues that want to come in? If not, then I'm going to... Wenjing, sorry.
Yeah, I don't know how much time you have. Just to quickly to mention that there's a question about whether the seasonal vaccination could prevent future pandemics. I think the answer is for the future pandemic vaccine, it will be a different type of composition that will be effective to the future pandemic vaccine. However, there's a lot of benefit in implementing seasonal vaccination now in order to prepare for the future pandemic. Just this point to be added.
Thank you so much. And Lisa, it's wonderful that you're here. I see you turned your camera on. Thank you so much. It would be great if you can take the floor also and offer some reflections.
Thank you so much. Hi, colleagues. I'm Lisa Menning from WHO and lead for our work on vaccine demand and behavioural sciences. And just to complement the excellent presentation and remarks from Dr. Nizar, really emphasising the importance in the current context of gathering local behavioural data and listening to communities so that we can really understand their questions and concerns and other types of barriers to uptake that might be access related, influencing social norms, etc. So with that better insight, we're then better placed to respond with tailored and targeted solutions and to really ensure that all of our necessary stakeholders are supportive of vaccination and the information that we provide across the program and through those trusted voices at a local level, our health workers and others, that they're really well equipped as well to be able to advocate and champion and fill in any of those information gaps. So thank you very much to presenters. Excellent work here, and looking forward to seeing the work ahead. Thanks.
Thanks so much, Lisa. And thank you to everyone. We are at time now, so I think we will stop with the questions now. But obviously, it's a topic of great interest, so we will have to see how we can continue the discussion and continue to have this dialogue along on this very important topic. So Supriya, thank you again, and over to you.
Thank you very much, Iona. And I would like to I agree with you. It's been a topic of great interest and very interesting questions. So I would like to thank, first of all, Soshana for setting up this webinar with this very interesting topic. I'd like to thank, of course, all the participants, Iona, Wenching, Chesko, and there's Nizar, Svitlana, Yasmin, and have I missed? I hope I haven't missed anybody, but thank you very much to all of the participants, and also Lisa. Thank you very much for your interaction as well. I'd like to thank the people who worked in the background here, Michael, Maria Isabella, and Sangamitra from our WHO Collaborating Center, Project ECHO, for supporting with this webinar. But most importantly, I'd like to thank all of you who participated. Thank you for being here, for making the time to be here, to ask questions. And we would love to hear from you. If you have more questions or insights to share, please do write to us at EPI-WIN @who.int. The email is on the chat box. And I would like to invite you to join us again for the next EPI-WIN webinar, which is on the 15th of October, and it's on the chat, the link and the date and the time. Usual time, Wednesday, 1 o'clock. It's on innovative risk communication and community engagement tools for developing capacity in the countries. So we have some very exciting new tools. We'll hear from the regions, particularly WHO Euro, who's developed this CAP map tool that countries can use to map their capacities. And we'll also hear from PAHO about how they've developed this package for arbovirus based on RCCE tools for arbovirus. So we look forward to seeing you 2 weeks from now on the 15th. And once again, a huge thank you to everybody. Bye.